very happy to welcome Dr. Allyson Barker to join us today for a discussion about common vaccine myths, questions, and concerns. I will let you go ahead and introduce yourself, Dr. Barker, and then we'll get going.
Thank you, Carrie. Hi, my name's Allyson Barker. I'm a doctor of osteopathic medicine, the DO, practicing in rural Roscommon, Michigan. I also live here with my family. I did medical school and undergraduate at Michigan State. So I'm from Michigan and currently practice in rural northern Michigan, a bit north of Lansing area.
For those of you who haven't joined us before, my name is Carrie. I'm an extension educator housed in Livingston County. I work on both parenting education and then projects like this, along like our vaccine project grant. So this is dovetails very well into much of the rest of my work because we in all of our work with parents can't help but end up coming across issues around vaccines and questions and concerns about vaccines. And so I appreciate getting to have the chance to have this conversation today. So we're going to start off today with a short video.
Every time I went into the doctor's office, they had asked me if I wanted a flu shot, and I said, no, I never get a flu shot. I'm a teacher, I'm pretty much immune to everything, and so that's how it started.
She'd been sick for a while, on and off since about Thanksgiving. It happened around Christmas or so where she started to get more sick. And I think we both got the flu at the same time, and so I was down as well for a couple days, and then she just got progressively worse.
Well, the first time I went to urgent care, and they said I was just a little dehydrated. And then the fourth time that's when they realized that there was something wrong with me.
And her lungs were basically flooding and she was drowning, and that she needed to be, she could fight it or whatever, but she was going to have to be intubated and probably put under, and that it was serious. She looks like she's asleep and just completely flat on her back and passed out, and they have a tube down her throat, and the machine is breathing for her. She has tubes running in all different directions. I think she was on, I had a full page of medications that she was on, and she probably had about eight different IVs running through her.
I think from the pictures that I saw, I think I was really swollen. I looked like somebody filled me up with water. My face was really big, my hands were really big, everything was swollen.
And I told him, Mom's serious and she's in the hospital, and I told him she's there and there's a strong possibility she may never come out of the hospital. She drew this picture, and I don't know if we still have it or not. Yeah, but like a crayon drawing. She was only in there for maybe 5-10 minutes, and then she drew that we hung in the room for her mom.
Before I went to the hospital, I would just get up, do whatever I want, work out, run around, regardless of my asthma, regardless of my allergies. I would just get things done. Now there's just not getting anything done. The forgetfulness I've had, it's almost like something just turned off, and then it'll turn back on again. I'm losing my train of thought right now, actually. Yeah, it's really difficult, focusing and concentrating.
We thought we were invincible. We thought that we didn't need to get that. We don't ever get the flu and this and that, but a perfectly healthy person that came to the brink of death because of that kind of arrogance in a sense and ignorance.
I thought, because I worked in the classroom, I don't have to get a flu vaccine because I've just been exposed to every kind of germ out there, but it's not true. You have to get a flu shot every year. That was the first time I've ever gotten a flu shot when I was in the hospital. I got mine this year, and it's really important that you do that because you just never know. You're probably looking at this and thinking, that'll never be me. That's what I thought. I thought I'd always see these videos and thought, that'd never be me. And it's me.
That was a very compelling story. Do you have any thoughts you'd like to share about that before we get going?
Yeah, I just think that last bit, just saying, you never think that would be you, or you never think that would be my kids. And how many people we see in the office where it does happen. The severe cases are what happen. And that's what we're trying to protect against with kids, with adults. And we don't want that story to be your story or to be my family member's story or my patient's story. And so that's why I think we're all so passionate about this. And thanks for sharing that example. Even though it's really sad and tragic, I think it's important to know we often think that. We often think it's never going to be me. It's never going to be my kids.
It always seems like it's at arm's length away, right? It's something that happens to somebody else, but not doesn't seem like it's us until you hear that kind of story. I know I was a preschool teacher and a child care center director, and I certainly felt like I'd been exposed to every germ on the planet when I was working with little kids. So it's easy to think that you might have some sort of extra protection against something like that. And it's also easy, I think, for many people to dismiss the severity of things like the flu because it does seem like something that's such a common illness. We're going to get going with our questions. And like I had shared previously, people are welcome to enter your own questions in the chat as we get going here. The first question is about babies getting vaccines. And I know that this is a common concern that many parents had. I know I was concerned when my kids were getting vaccinated. The question is, can babies handle getting so many vaccines at once? It seems like they get so many more than they did when we were little. Is it safe to do all those vaccines at once?
Mm. That's a good question. And it's probably the most common question that I get from parents. So I don't think I actually said it at the beginning. I'm a family practice doctor. So I care for babies through adults. So vaccine questions are something I field all the time, every day in the office. And yeah, this is definitely the one from parents that comes up most often, which is, I think, reasonable. It's a really understandable question because in the first years of life, babies get vaccines to prevent 14 different diseases, infections, and that can mean up to 30 vaccines during the first year of life. And at the 1 year visit, it can be up to 6 shots at one time. And from personal experience, I have 3 kids. They're all under age 5. And so from with my kids, it's hard to watch your baby go through that. And so I think that's a lot of times what parents are, where they're coming from, what they're asking. And as a mom, I feel that. But I think it's important to know that when babies are in the womb, in mom, they're in a sterile environment. And so when they enter the birth canal, they're immediately exposed to so many different things. And actually, their skin itself gets colonized, where bacteria live on their skin. It lives on all our skin. But when baby goes from that sterile environment out into the world, they're immediately colonized with trillions of bacteria. And I'm not just saying that, it's true. It's trillions of bacteria. And each bacteria has an array, many immunological components. And they say even between 2,000 and 6,000 on each bacteria. And so that's a lot a baby's immune system is responding to just in our natural environment. And that's what the immune system is made to do. And so now we know there's more vaccines than ever before, but actually small children are exposed to less immunological components than in past decades. So before, they were getting a lot more components in the vaccines. And now that there's more vaccines, there's actually less components. And I actually looked this up. There's 160 immunological parts that are currently contained in vaccines. So compare that to the 2,000 to 6,000 on each bacteria. Really, it's much less. So my answer to that question is yes, babies can definitely handle it. That's what our immune systems and their immune systems are made to do. And it's basically what they're exposed to in a vaccine is like a drop in the ocean in what they're exposed to in their daily lives.
Wow, that's fascinating. I didn't realize that there was that big of a difference between what babies are exposed to from vaccines and then just what they're naturally being exposed to. That's fascinating.
Yeah. Mm-hmm.
This next question really dovetails right into that issue about how many vaccines kids get at once. I know my kids are older now, but I know when I was navigating the world of vaccines with my kids, there was often talk of an alternative schedule, or parents would choose to do an alternative schedule. So the vaccines are staggered and aren't all given at the same time, like they typically are according to the CDC schedule. Is that kind of alternate schedule just as effective as having them on schedule?
A good question, and another one I get a lot. And I will say that this type of schedule, to answer the question directly, is not as effective. The schedule serves a purpose. So vaccines are added to the schedule based on when a baby is most likely to be affected by an infection or disease. And so delaying can leave them more susceptible or affected by certain things. And it's important to know that many shots require more than one dose. And so if you limit what a baby's getting at one appointment and kind of delay it a month or a few weeks later and do maybe 1 or 2 shots at a time instead of what's recommended, it's actually nearly impossible for the baby to get all the doses needed for full protection. And it's actually very uncommon for parents to stay on top of that every 2-week or month visit to the doctors to really be able to stay up to date with a delayed schedule. I think that it's hard to bring your kid to the doctor that often. And that can really affect kids, I think, having to come in, get multiple pokes, and lead to potentially more stress and risk of needle phobia over the long term. And they did study this with kids receiving multiple vaccines at once compared to kids who only got a single vaccine, and they were rating stress levels. And they showed that ones who did not get multiple vaccines compared to ones who did, there was no difference in their stress level. And so I think that consideration of the time, the lack of ability to really get up to date, and the fact that you're bringing your kids to the doctor so often. And then going back to that first question, we know babies' immune systems can handle this. So that's my recommendation, is to stay on the schedule for those reasons.
Yeah, that makes so much sense when you think about it. I know with my 4 kids getting in and getting well child visits and then all of the sick visits for things like ear infections and whatever, already felt like we were going to the doctor all the time. So trying to add in those kind of additional visits would be really challenging. Great. One of the things that many parents worry about, one of the reasons that they tend to, I think, try to move to these alternative schedules or delay some vaccines, it's about concerns around toxic substances that are in the vaccines. So our next question is, do vaccines contain toxic substances like mercury and formaldehyde? And if so, is it safe to be injecting those into our kids?
That's a good question. Again, I think there's actually a link that I think would be helpful if we can maybe share it just with some vaccine ingredients and information about what's in each vaccine, because what's great is that everybody's really transparent. So the CDC, I love the Children's Hospital of Philadelphia's resources on vaccines. CHOP is what it's known for, because you can go through each vaccine and see exactly what's in it, what it means, and the exact amounts in micrograms of what is in each vaccine component. I think that's really important and a good place to look, because like I said, they're very transparent. We know what's in each vaccine, how much exactly is in each vaccine. And so back to the question, do they contain substances like mercury, formaldehyde? The answer is some of them, yes, they do. However, I think it's important to know that the amounts of these ingredients in vaccines are not enough to cause any type of harm, even when the multiple vaccines are given at the same time, like we talked about with the current schedule. So why are they in there? I think is another question I get, because they are needed to help keep the vaccine viable and to help produce an immune response as well. If we look at kind of the 3 questions that I get most, or that people talk about, formaldehyde being one. And again, that link will have specifics on this, but specifically formaldehyde is actually in our bodies. Our bodies make this. It's important for formaldehyde for DNA formation. And we all have quantities of natural formaldehyde. Babies actually have quite a bit of formaldehyde, and they calculated, I looked this up to see, they calculated in a 2-month-old, they have 1,500 more times formaldehyde naturally than what's included in their vaccines in the first 6 months. So that's just one thing, that's a preservative that's there to keep the vaccine viable. The influenza vaccine, one we get commonly questioned about is mercury. So thimerosal is a mercury containing preservative that's in some influenza vaccinations, but it's actually a different type of mercury. So this is going to sound really scientific, but ethyl mercury or methyl mercury, and methyl is the one that's more toxic to people. Ethyl is actually secreted and cleared by the body, broken down much more quickly, and it's not likely to accumulate or build up in the body. And they've actually studied this quite a bit, and there's really no accumulation or toxic side effects at the micro amounts of this in the influenza vaccine. And it's in some, not all. And that information specifically, again, is at that Children's Hospital Philadelphia resource. and then aluminum, which I think this one is known to be in vaccines, but it's also well known in many things that we eat or eat on in our daily lives. So pots, pans, storage containers, foil, aluminum cans. It's actually in cereal, nuts, baby, infant formula. And it's in there as an adjuvant. So it's in vaccines as an adjuvant, which what that means is it helps the vaccine make a response. And infants get much less in the first 6 months of life than they do just in normal intake. Breastfed infants, formula fed infants have more in their day-to-day intake in the first 6 months than what's ever in a vaccine.
You'd think I could unmute after all these years on Zoom now, but I'm still tripping on that mute button. That's really fascinating information. I didn't realize that we had some of these things naturally occurring in our bodies anyway. I did go ahead and make sure that link was shared in the chat here on our webinar and then also on Facebook.
Great, because there's a lot of detail with that. And I think that's it's really difficult to explain all the parts. And I think definitely check it out for yourself and read through that. It's very helpful.
Yeah, that's great to know. Again, with the components of vaccines or what's in vaccines, I know that for a few years, it seems like we were hearing that there were some vaccines you couldn't get if you had an egg allergy. So our next question here, the person's wondering if their child who has an egg allergy can get the flu vaccine. And then if there's any other vaccines that you can't get because of food allergies.
So this one's personal to me. Actually, my son has an egg allergy. And I remember being like, I know that there's a question, there's some egg in the influenza vaccine. And now I'm actually questioning it for my son. And recently, there's been a lot of research in the allergy and immunology world that infants and children and adults who have egg allergy, even anaphylactic, severe egg allergy, can get the influenza vaccine. And that is because they've made advances where the amount of egg in that vaccine is so minute that it's not likely at all to affect those with egg allergy. They do recommend that those kids, adults, monitored for 15 to 30 minutes after receiving it. However, I'll say that my son, who has a severe, at one point it was anaphylactic egg allergy, received his influenza vaccines. After we talked to the allergist, they're like, absolutely, we know that this is safe, and absolutely was safe for him with no reaction at all. And so in terms of the other vaccines that may contain eggs specifically, so really it's not on the immunization schedule, it's more for international travel, but yellow fever vaccination does have egg, and that one has a little bit more. So those with severe egg allergy should talk to an allergist before getting a yellow fever, but that's again not something that's in our routine schedule. That's if you were traveling to specific countries. In terms of other food allergies, so peanut, corn, oils are not in vaccinations. So there's not a risk with those types of allergies. Yeast is also not a concern. If somebody has a yeast or gluten allergy, again, not a concern with the current vaccines that we have. And those probably are the most common questions regarding food allergies.
That's good to know. I personally have an anaphylactic tree nut allergy, so it's scary, and I understand why people are worried about these ingredients. But it's great to know that we can get them, and we don't need to worry too much about that. Our next question is regarding immunity, and it's interesting. This is the kind of very much the topic of our first video that we watched to start us off here. Is the person's wondering about natural immunity versus vaccinated immunity. Is it just better to let our bodies fight that infection for themselves, or is there some truth to the fact that natural immunity is better than vaccinated immunity?
So there is some truth to the natural immunity versus vaccinated immunity, because most of the time, natural immunity is better than vaccinated immunity. But I think that, like in the video really pointed out and made that really poignant, is that there are risks with that approach, and we need to consider those risks seriously, because when the disease is considered less high risk, parents or people may prefer that they get the natural infection or that their kids get the natural infection because there could be a disease that has a stronger immunity. But like with the video with influenza, we see that while in some the disease is benign, but it's not like that for everyone. And there can be serious complications, even horrifically life-threatening complications with this approach. I think the video talked about influenza, but I also want to talk about chickenpox, because I think that for many of us, before the chickenpox vaccine came out, we got chickenpox, we did okay with it. However, before that vaccine was made available, there were about 70 children a year, 70, who died from the disease, and most of whom were previously healthy. And again, you think that's never going to happen to my kids or to me. And that number should be 0. 70 is just far too many. And because we never know who's going to be severely affected by chickenpox, it's recommended that all children get that immunization. And then going back to flu, I hear from so many people, I get the flu every year and I do great with it. As you get older, your immune system does tend to wane. And so especially those vulnerable people, ages 65, if you've never gotten your flu shot, I'd recommend that you start to do. Flu is also a respiratory virus. So I think there's a lot of misconceptions about what influenza is. Influenza is not the stomach flu. Influenza is a respiratory cough, body aches, fever, not typically vomiting, diarrhea, like a lot of people think of with the stomach flu. And influenza can cause severe complications, hospitalizations, and death for those vulnerable and sometimes previously healthy people. And I think that's part of what is important and what was highlighted in that video. So I think instead of saying, is natural immunity better? The question might be better asked, is vaccine immunity good enough? Because the answer is yes. Immunity from vaccines is much better. It is good enough, excuse me. And it comes without paying that price, that concern that we talked about with natural infection.
Yeah, that's such an interesting question. I know I can remember the chickenpox parties of my childhood, and you don't tend to think about it from that lens, right? So if vaccinated immunity is good enough, then it really isn't worth incurring that extra risk of exposure. And it's no fun to have chickenpox. I remember being very sick when I had chickenpox. All right. So another myth that has caused many people to avoid vaccination is about autism. Excuse me. And so our question here is it true that the MMR vaccine can cause autism or causes autism? And would this be a reason to decline that vaccine?
So the answer is no. The MMR vaccine does not cause autism, and it is not a reason for parents to decline that vaccine. I think a lot of people will look at the numbers of kids with autism diagnosed has increased over the last few decades. I think there's 2 reasons for this. One is that we are becoming more aware of autism and the symptoms and signs, and parents are getting their kids more rapidly identified, diagnosed, and into services appropriately. So that's one reason. It's just becoming more known, more identified, and better diagnosed. So that's a reason for the increase in amount of autism that you'll see. The second being that the definition of autism has changed, where previously mild cases of autism were identified as Asperger's, and that's no longer, those are now diagnosed as autism. So there is a spectrum of autism, and there is no longer the diagnosis in terms of what we use in our documentation of Asperger. There is autism. And so you'll see that mild cases, which were previously not being diagnosed as autism, now are. So I think those 2 things are really important in terms of why is there an increase, because a lot of people who have a fear or have read some maybe misinformation about autism and vaccines would say, look, there's more cases, there's more vaccines to the schedule. Could this be a correlation? And the answer is no. And this has been thoroughly researched, because the initial fear concern came from a study. It was like 1990s, Andrew Wakefield, and it was put in the Lancet, which is a prestigious medical journal. And it was suggesting in that study that the MMR vaccine was increasing cases of autism. But it's since been discredited, and there was severe procedure errors, financial conflicts, and ethical violations. And so it was discredited. However, the medical community took it seriously, and there were major studies conducted to look into this, and none have since found any link between any vaccine, specifically MMR, and the likelihood of developing autism. And I think also we want to know, why are kids developing autism? And it's a mystery. We don't know that at this time. However, studies are now identifying signs of autism are present well before children receive the MMR vaccine. And there's even more recent research suggesting that it could be developing in utero well before a baby is born or receives any shots or immunizations.
Yeah, I know it's been such a such a tough study to thoroughly get communicated that it's debunked, that we know it's not true. That
Correct.
The news that there was a potential harm certainly spread much faster than the news seems to be spreading that there is no harm and it's a safe vaccine. Our next question takes things in a slightly different tactics. This is less about the vaccine itself as it is about concepts related to the vaccine. This person's wondering about the HPV vaccine. And the question is, does the HPV vaccine encourage youth to be more sexually active? And if so, shouldn't we be waiting to vaccinate them until they're older?
Yeah, I get this question a lot too. And I'm really passionate about the HPV vaccine because we talk about people always want to know a cure, a prevention for cancer, and we have it with the HPV vaccine. And I want to talk a little about that. But I think the concern comes from parents with their youth vaccinating it against a sexually transmitted infection. So I think it's important to know that first, HPV is much more common than people actually realize. And 80% of women and 90% of sexually active men will contract some form of this throughout their life. And it's not just girls that get HPV. And so that's, I think, a big part of this is knowing that it's a disease infection that can affect both men and women and be cancer causing in future. Specifically with women, it's cervical cancer, but for men, it can be head and neck cancer later in life. We see a lot of head and neck cancers that stem from HPV infection. And so this is a cancer preventing vaccine, which is amazing. And they did study this. So that's the question that I get is because it's a sexually transmitted infection, will the youth or will my children think that, oh, now I can have unprotected intercourse, or now I'm okay to have sex without worrying about sexually transmitted infections? No, this is not true. So Journal of Pediatrics studied this back in 2012, and that any age at getting the HPV vaccine at the recommended age was not associated with increased sexual activity rates. And there's no proof at all that the HPV vaccine gives girls or boys just permission to have sex. It's not about stopping a sexually transmitted infection, but it's about stopping the spread of cervical cancer and head and neck cancer for our youth and into their future. And I think it's important, like they talk about youth getting it, and really it's recommended to start at age 11 to 12. And so why that young? But it's really because of how common it is. And because it's so common, it is important to vaccinate well before adulthood to really best protect from HPV.
We actually have a whole webinar about the HPV vaccine that we did earlier this year. So if people have more questions about the HPV vaccine, we have a whole hour of HPV content that you can access. We learned some really interesting information about the HPV vaccine when we were doing that webinar. We also have one about the flu vaccine if people want to hear more about that. Our next question is about not receiving vaccines as a child. And it's interesting, my oldest daughter is 19, and when she went away to college, she had some friends who were trying to get caught up on vaccines because they had not received them when their parents were making their medical decisions. They had chosen to delay or to not give them some vaccines. Now that they are over the age of 18 and making their own medical decisions, they were seeking out vaccines. So this person is wondering if you didn't get vaccinated as a child, or perhaps your parents, you skipped some vaccines as a child, can you get those childhood immunizations later on as an adult?
Good question. Yes, you can get most all of them. The CDC actually has an adult vaccine quiz. So based on what you know, you can take this quiz and find out what you're eligible for, and then come to your doctor appointment with that information, or ask your physician about it personally to see what they recommend that you need to get up to date. Oh, somebody attached that. That's great. So you can click on that and find out what you're due for. Important though, certain vaccines will phase out that you no longer can get after being an infant. So rotavirus is one of them, Haemophilus influenza B, pneumococcal, until you're 65. So those you would not be eligible for. but others including MMR. So if you never got MMR, if you're not sure, you can request your immunization record. But if for some reason you can't get it, you don't have it, you can ask your doctor for a titer, which basically is a blood test to see if you have antibodies to measles, mumps, rubella, Hep B, and see, do I actually need those vaccines? Have I gotten them? Have I not? And we can vaccinate after to see if you have a positive titer if you're not sure. But R would be one to update. Polio would be another that you can get. Chicken pox is another. If you've not had the natural infection or were not immunized, you can and should get up to date on that. Hepatitis B, and then HPV. So this one's newer, up to age 45 that you can actually get vaccinated for HPV. Previously, it was 21 to 26. So now it's up to age 45. So important to talk to your doctor about that. Don't wait until 44 in a few months. You want to make sure you give yourself that 6-month window. But if you're 44 and have not received it, definitely talk to your doctor about that.
Yeah, I think the other one that is on that list is Tdap. And I know
Thank you. Yeah.
I got the Tdap vaccine shortly after my niece was born, made sure that was up to date before I was around the baby. That's another one I think people often receive regularly as they're getting older. My OBGYN was sharing that she often encourages women who maybe didn't receive the HPV vaccine, but are now newly single and are going to be dating again to make sure that they're getting vaccinated. That's something to take into account for women as they get older. Okay, our next question is something we certainly heard a lot about during the peak of the COVID epidemic. The question is about kickbacks from vaccines. Do healthcare providers and/or healthcare systems receive kickbacks from pharmaceutical companies for providing or giving those certain vaccines?
Some insurance companies will provide, we call it a quality of care bonus to doctors if they meet certain measures, such as regular well child checks, like keeping up to date on their asthma recommendations and keeping kids up to date on vaccinations. But this is designed, and there's a reason for this, it's to prevent low vaccination rates caused by other things like, I didn't check their chart to see if they were up to date. So it's really encouraging us to stay on top of preventative care measures. So vaccines are preventative care, and they're a cost-saving measure. The money is in when people don't get vaccinated and they get hospitalized and have severe types of infections. So we're really working on preventing that severity so that they don't need more care, which is where that financial cost would come from. And so by actually recommending vaccinations, we are ultimately, hopefully, protecting our patients and our kids from that more severe worst case scenario infections, which would require the real big financial burdens to that patient or that family. The other thing is primary care doctors, pediatricians, family, internal medicine, they make little to no money regarding vaccines, and some actually lose money because there's a lot of other factors that go into that, including nursing time, billing time, and then the cost of the supplies to provide the vaccine. And it actually exceeds that reimbursement typically that they might get from insurers and healthcare plans. So really the thing is it's because it's a part of preventative care. Each insurance company does provide that quality of care bonus to make sure that we're on top of preventative care. And there's the reason for that, because we're preventing the bigger health costs and the worst outcomes for our patients and trying to stay on top of things.
I hadn't even thought about that, but you're right. If the money is there to be made in people becoming sick and being hospitalized, you're going to make a lot more money if somebody is ill rather than preventing them from getting ill in the first place.
And I think important, like we, as your doctors, we went into this career. I went in this career to help people be healthy, especially primary care, internal medicine, pediatrics, family medicine. There's a lot more lucrative specialties. And I think a lot of us, if we were more interested in making money, we would have gone into a more lucrative specialty. We want to meet people where they're at, help them be healthy, help prevent severe disease. And vaccines are a part of that, which is why so many of us are passionate about it.
Yeah, definitely. Our next question is something I know I also heard a lot about as I was making decisions about vaccinating my kids. It seems like we're vaccinating against things that we really don't hear about happening in our community, like polio. Is it necessary to give our kids vaccines for things like polio that are pretty much eradicated? It seems really unlikely that they're going to be exposed to that in the first place.
Mm-hmm. Yeah, I definitely was thinking about that with my kids too. Just, wow, I haven't heard of a polio case. I've not seen a polio case. I've seen a lot of post-polio in the office, and you can see the severity of that infection that thankfully, due to herd immunity, which is like a large majority of people being vaccinated in a population, then the unvaccinated minority are protected. But with people declining polio vaccine, polio is not eradicated. So it is still around in other countries. There was a case in New York. There will always be a portion of the population that can't get it, or there's going to be people that have chosen not to get it. And so if not enough people get it, we lose that herd immunity that protects our communities from these infections. And because there's been more international travel increasing, we can bring things that are eradicated in the US back into the US, specifically polio. And we can contribute to this big danger, this danger of an infection like polio taking hold and spreading in community spread. And that's really what we're protecting against. If something becomes fully eradicated, like smallpox, for example, that's obviously evaluated and those vaccines are taken off the table, but polio is not eradicated in the world at this time. There's really a lot of information about where there are active cases, and you can find that online. But just know that these immunizations are still on the schedule for a reason, because it is not eradicated. And we want to keep that herd immunity up to protect those who are most vulnerable, who cannot get vaccinations from these types of diseases, like the elderly, babies.
Yeah, especially I think about vaccines like polio that were so impactful in reducing people getting sick. And polio, my childhood best friend's mom had polio growing up and was greatly impacted in her adult life from her exposure to polio. So on that subject of declining vaccine or declining rates of people becoming ill, our next question is about the spread of illness. So the question is, I have heard that contagious diseases are declining because of hand washing and better hygiene practices, and that vaccines are not really the biggest factor in reducing the spread. Is that true?
So I think that it's important to know that vaccines don't deserve all the credit. So there is definitely an impact that sanitation, hygiene has made in our control of infectious diseases, as well as antibiotics developing. And so nutrition improved. So there's many factors that go into the decline of these severe diseases. But when they isolate it, you can't deny the role that vaccines have played. And I think there's two examples that I can think of. So measles being one, and then Haemophilus influenza B being another, that can clearly see the role that vaccines played in the reduction of cases and infections. So measles was introduced in the 60s. The rates of infection were stable, steady. And then following the introduction of the vaccine, and we already know sanitation, nutrition, hygiene had improved by quite a bit in the 60s. So the vaccine was introduced and the cases declined in the following year. And then up to from 400,000 down to 25,000 cases by 1970. So in that 7-year period, there was a dramatic decline, and we can isolate that to be attributed directly to that MR vaccine. And then Haemophilus influenza B, which was introduced in the 90s. So cases dropped from, they were holding steady around 20,000 in the 1990s to early 1990s to 1,500 in 1993. And so in those cases, we can see that Haemophilus influenza B vaccine was the direct cause of that decline, not sanitation, nutrition, hygiene, because again, those were already well in place in the 90s.
Great. Yeah, it's interesting to look at that data and to really be able to see that shift in the trend there. Our next question is something about the flu vaccine. And this is certainly a question that we've heard again and again. Can the flu vaccine give you the flu?
No, the flu vaccine cannot give you the flu. So it can, what commonly people get is vaccine like an immunological response. So your immune system responding to the vaccine, and some people can get mild symptoms that actually are just like the flu. So body aches, low grade fever, fatigue, joint pain, that's actually not common, but that's where people will think, oh my gosh, this vaccine just gave me what I was trying to protect against. This is much more mild. This is not the flu infection. This is your body responding to the vaccine. And it's your immune system responding strongly to the vaccine. And that's a good thing. That tells you your body's responding, your immune system's working well. It doesn't feel good for obviously those 12 to 24 hours that it can happen, but it's much less severe than what you would have gotten with influenza itself. So no, the flu vaccine does not give you the flu, but in some people you can get kind of flu-like symptoms is what we've called it, where you can get that low-grade fever, body ache, fatigue.
I think many people experience something like that following their COVID vaccine. I know I did, having those kind of that immunological response to the COVID vaccine. Planned mine to make sure I had it on a Friday so I could not feel well on Saturday and make it to work on Monday. Our next question.
Just so can I add something? Just
Sure.
So you guys, another thing to know is the other one. So flu vaccine, COVID vaccine, and then actually the Shingrix vaccine. So shingles vaccination for adults above age 50. That's the other one that's definitely going to cause some flu-like symptoms for 12 to 24 hours. So I always talk to my patients about that, just so you know to time that, not before you have a big event planned the next day, because you can feel pretty run down from those viral vaccines that tend to induce a little bit more immune response and those flu-like symptoms.
Yeah, you don't want to be getting that shingles vaccine the day before a wedding or something. You're not going to be feeling
good. Exactly.
Yep. Our next question came in from an audience participant, and the question is there a danger of mutations and variants due to viruses continuing to be transmitted throughout a population over a long time? So if we have a virus that's continuing to be transmitted, are we going to see those mutations and variants that happen? I would assume like we're seeing with COVID, some of the mutations.
Due to viruses continuing to be, I'm just reading the question. Danger of mutations and variants due to viruses. And I think if you specifically think about with COVID, those mutations and variants will continue to arise. And I think that's why they're working on continually updating our bivalent COVID vaccines to protect prior to that year or season. We typically see, so you saw with the bivalent COVID vaccine update for specifically the Omicron variant, and I anticipate there will likely be an update to that maybe in the fall or next year. With the flu vaccination, this is updated every year to try to protect against variants and mutations that we expect or anticipate with the flu shot for the next season. So with those two specifically, we know that is likely to be the case and to be an effect for the population from now on. At least that's what we're seeing with COVID, more that endemic, and something we're going to need to work on protecting against with our vaccination schedule and protocol and boosters, which we can potentially talk about. And we know that with influenza, it's recommended yearly to get that flu shot because of those mutations and variants that occur with the upcoming season. So I would say there is a concern for sure with mutations and variants, specifically with COVID and influenza affecting our population for long term. And that's why the CDC stays on top of those recommendations to better protect the community for each of those seasons.
Yeah, that makes sense. And again, we have a webinar from earlier. It was about a year ago, just shy of a month or two here, where we really delved into talking more about the flu vaccine and the COVID vaccine and what we do to help stay on top of the variants that are changing as time is going on. Great. Our next question is about live and dead vaccines. So our question is, I've heard of live vaccines and dead vaccines. What are they? Can you talk more about that?
Yeah, so live vaccines are a weakened form of the actual germ or infection or virus or bacteria. So a weakened but viable live form that causes the disease. And then if you think about dead vaccines, we have inactivated or we call recombinant. So inactivated is just a killed version of the germ used in the vaccine that causes the disease. And then recombinant uses a part of the germ. So a part of the bacteria, a part of the virus that's identifiable by our immune system. Maybe like we talked about like the spike protein a lot with COVID, using that specific target to allow your body to recognize it. So that's like more what the recombinant is. So recombinant and inactivated are the dead vaccines, and then the live vaccines are the weakened version. So you're going to get a better immune response from a live vaccine, and that makes sense, because it more resembles an actual infection because it's the live version, but a weakened form. Now, again, this does not give you the disease. However, that's why we caution, and the CDC is very clear on this. There are certain people who cannot get live vaccines. So it's very important to talk to your doctor about that. Those with weakened immune systems, pregnant women, there's reasons to avoid live vaccines at certain times. And I think that's, again, important to talk about. Are you one of those people? Talk with your doctor about it. We know well about these. And so that's really important, but they're very similar to the natural infection and will create the strongest and longest lasting response. And you're like, why aren't all vaccines live? It's actually difficult to keep those viable. They have to be kept at a certain temperature. They're difficult to transport. So not all can be. So that's why we have the recombinant, we have the inactive, the dead type of vaccines. And so I think the big one to know, the live vaccine examples that are currently in the schedule, MMR and varicella.
Yeah, my dad was a kidney transplant recipient. So I remember having some of these conversations as we were navigating his care, because he was not an eligible candidate for those live vaccines. We have several COVID questions, and we're running out of time here. And I do want to get to some of these COVID vaccine questions, because I know people do have a lot of questions about the COVID vaccine. Our next question is about the mRNA vaccine. So do mRNA vaccines like COVID change your DNA? Does it act differently in your body than other vaccines might?
No, the mRNA vaccines do not change your DNA. They do act a little differently. And so messenger RNA is something that's in your body. Messenger RNA in the Moderna and Pfizer vaccinations, they enter your cells. So the mRNA enters the body's cells, but it does not enter the nucleus. So in the nucleus, which is the center of the cell, that's where DNA is made. The mRNA from the COVID vaccine does not enter the nucleus, which is where the DNA is. It's actually enters the cell. It does its job to create the protein that stimulates the immune system. And then it quickly breaks down inside the cell without entering the nucleus and without affecting your own DNA.
Okay. I know that there were a lot of questions about the COVID vaccine as it was coming to market, and because it came to market so quickly. One of our next questions here is about the speed with which the COVID vaccine came to the market. The question is, I'm worried about the COVID vaccine because it came to the market so quickly. It seems like it might not have been studied as much, especially because it's this new mRNA technology. Is there a reason that we should be concerned about the mRNA vaccines?
So the mRNA technology, although many people were not aware of it, has been in development and research for almost 20 years. And they created this technology years ago to help them respond quickly to a new pandemic illness, such as COVID-19. They just hadn't had to implement it and did at that time, but it is well researched and founded prior to its introduction. So I just think that's really important to know. This was not just developed right when COVID happened. They had been researching, studying, and producing mRNA technology for vaccinations and hopes to be able to use it before. And so this is well studied and safe type of technology for vaccinations. And so I think it's important to know that, and important to know that we feel that this is a safe option, especially in this setting, because we were able to do it quickly and also respond to different variants, like with the bivalent vaccine, like we would never have been able to with others, because of this great technology.
That's what I was just going to say. It's fascinating technology. I do want to just draw everyone's attention to the chat. There is a link a Qualtrics link in there. If you could take just a minute to complete that link and let us know what you've learned today, we'd appreciate it. We do have time for maybe one more question. And this is really one that I was hoping to get to, because this is something, as a mom of a teen boy, I've heard a lot about The question is, I'm really worried about blood clots and myocarditis when it comes to the COVID vaccine. Is this a really big concern? And should I be declining it, perhaps particularly for my teens or my teen son?
Yeah, I definitely get this question a lot too from parents and from young adults, 18 to 24. Let's start with the blood clot part. So specifically, this came into concern based on the J&J vaccine because they were seeing that there was a low platelet thrombophilic or clot risk in a very small amount of patients that they saw this. And so the CDC actually updated its recommendation in 2021 with specifically the J&J vaccine to where they would recommend the mRNA preferably, unless those who in certain circumstances, like due to allergies, cannot get the mRNA vaccine. And so important to know that this was something they identified in an extremely small amount of patients. But I think the big thing to also know, and something that I saw so much and still see from COVID infection, is the risk of clotting from natural infection from COVID. And so I think, like we talked about with all of these things, weighing that risk and benefit, the benefit and the risk, of natural infection, specifically pulmonary embolism, which is clots in the lungs, was more common in severe COVID infection and much more common than any risk with J&J vaccine specifically. They have not found a link with any mRNA vaccine with clotting like they did specifically in that small amount of patients with J&J. However, pulmonary embolism is something I saw a lot in hospital follow-ups with severe COVID, and it can be devastating and then cause prolonged hospitalization, coming out of the hospital on oxygen, which I had never seen in my entire career prior to COVID because of that clotting and thrombophilic, we call it thrombophilic clotting risk of natural COVID infection, which again is much higher. And I think that goes to myocarditis as well. So again, myocarditis, inflammation of the heart muscle, pericarditis, inflammation of the heart muscle wall. Mainly it was seen in male teens and young adults. And it has been reported more frequently than expected following receipt of the mRNA vaccines. However, what they've discovered is that this is very infrequent, rare, and typically mild in nature. So they've shown that the benefits of the vaccination have outweighed the risk. And the cases that have been reported are mild and did not require treatment, or if they did require treatment, they required minimal treatment and responded quickly, typically discharged if they were hospitalized or managed outpatient. So there have been very rare report of a persistent myocarditis in an individual post an mRNA vaccine. However, again, like I talked about with clotting, it's important to know that the risk of myocarditis from natural infection from COVID is much higher. And I think that's really important to know because the issue is that the natural infection, COVID myocarditis, is much more severe than the milder cases that we have seen following an immunization from COVID infection. When children develop myocarditis from natural COVID-19 infection, it's typically much more severe and requires treatment, is typically more fulminant or longer lasting. So again, we're weighing that risk and benefit, but what we have seen is that the benefit of the COVID immunization far outweighs the risk of that natural infection. And specifically with myocarditis in those male teens and young adults, the risk of myocarditis from natural COVID infection and the severity of it is much higher than the small risk from the vaccination.
Great. As a mom of a teen boy, I appreciate that response, that detailed response and information. It's good to know that we're making the right decision and keeping him fully vaccinated. With that, we have reached the end of our time. I do want to offer you the opportunity if you have any follow-up or wrap-up questions that you would like to, anything you'd like to wrap up with before we close.
I think that was all. Thank you guys for having me. I'm thrilled to be able to chat with everybody about this.
Yeah, thank you so much.
Questions I get every day.
I know. Thank you so much for joining us. We really appreciate you taking the time out of your busy day to join us for this webinar.